Hi friends, welcome to classes by Lab Doctor. In today's class, let us study about the structure and function of this LDL cholesterol. So, LDL cholesterol, most of the time it is referred as the bad cholesterol because elevated level of this type of cholesterol is linked to high risk of developing your cardiovascular disease. So, this LDL is a type of lipoprotein. Remember, it is a lipoprotein which is there in our blood to carry the cholesterol and triglycerides to various tissues and cells. So, this cholesterol, triglycerides, they are not visible with the blood. So, we need a van to carry them, and this LDL acts as a van which will carry this triglycerides, cholesterol, and supply them to the various parts of our body, to the various cells. So, this acts as a carrier. So, this is a lipoprotein. So, when you see a lipid profile, you have various parameters: total cholesterol, HDL cholesterol, LDL cholesterol, triglyceride, etc. So, this LDL cholesterol is an important parameter in the lipid profile, and this is often referred as a bad cholesterol, because when you have increased amount of this bad cholesterol, you are at risk of getting heart disease, stroke, peripheral vascular disease, etc. So this is an LDL cholesterol which is lying in your blood vessel and sitting there and causing the damage, and this is a good cholesterol which is trying to clear it off. So HDL is the good cholesterol and LDL is the one which causes the inflammation and hence referred to as the bad cholesterol. So these are the various lipoproteins which will carry the triglyceride as well as the cholesterol. Chylomicron, VLDL, intermediate density lipoprotein, low density lipoprotein, and high density lipoprotein. So the composition of these also makes them a good or a bad type of a lipoprotein. For example, your HDL, it is almost 50% protein and very high density. That is why this is the good cholesterol. And low density lipoprotein, you will see that almost 50% of this is the cholesterol. So this LDL is going to load your cells with cholesterol. So if it is going to load it with cholesterol, then there are chances then it can also cause an inflammation. So it is made up of 50% of cholesterol, around 10% of which is triglyceride, 20% is a phospholipid, and 20% is the protein. And the main component here, 50%, would be your cholesterol, and the apolipoprotein which is there here, that is B100. So this is the composition. It is almost 50% cholesterol, 20% protein, phospholipids, and triglyceride around 10%. So this category of lipoproteins can also be divided as anti-atherogenic and pro-atherogenic. HDL is anti-atherogenesis. It is against atherogenesis, whereas LDL, chylomicron, VLDL, all these are pro-atherogenic. So this again you can see the density as well as the diameter. HDL is very small, and you can see the chylomicron being largest in diameter, around 1000 nanometer, and HDL is around 10 nanometer. This low density lipoprotein, this would be double the size of an HDL. This would be around 20 nanometer. So I have told you that this LDL is a lipoprotein. So it is having two components. One is the lipid and other one is the protein. When you see a lipoprotein, it is having two parts. One is the external surface and an internal core. So the external surface is made up of this phospholipid. So these are the phospholipid layers. So this phospholipid gives it a structure, it gives it stability, and also this is having two ends. One is the hydrophilic end by which it combines with the blood here, and this is the hydrophobic end, so that it doesn't mix with these triglycerides and cholesterol. It helps to maintain a pore, and through which it can carry these triglyceride and cholesterol etc. to the cells. So here the phospholipid monolayer also has unesterified cholesterol in between, and this is the inside core, which is made up of triacylglycerol, that is triglycerides, and also the esterified cholesterol here. And this is the apoprotein. This protein is very important in the lipoprotein, because this is the protein which will guide, this is the brain of this lipoprotein. So this apoprotein will guide this molecule where it has to go to attach it to the receptor etc. For all this we need this apoprotein. So for LDL you have an apoprotein B100. This ApoB100, what is there? This is a major structural component of this LDL, and it also acts as a ligand for the LDL receptor. So this is the apoprotein. So that to help the cells to take up the LDL, you need this apoprotein B100. So this I have told you that this is the receptor, LDL receptor, and this is the apoprotein B100, which acts as a ligand which will help in the transport of this LDL to the tissues and the cells. So this becomes an important part of this LDL, and it is very crucial for the clearance of LDL from the bloodstream. So if there is any abnormality in this ApoB100, it is not taken up by the cells, and there can be decreased clearance of this LDL. So it is a very important component of this lipoprotein. So here you can see the ApoB100. So this wraps around the LDL particle. It also provides its stability, and I've told you it helps in the interaction with the LDL receptor. So high level of LDL, particularly LDL containing this ApoB100, are associated with atherosclerosis, and mutation of this ApoB100 can lead to familial hypercholesterolemia. It is a condition where there is increased level of LDL. So what is the function of the LDL? Why LDL is called as the bad cholesterol? See, LDL main function is to deliver the cholesterol from the liver to the tissues in the body. So the liver makes this LDL, and that LDL function is it acts as a van which will carry the cholesterol and it will send it to the cells. Suppose if this LDL are very high and our body cannot clear it, they start acting as a nidus for atherosclerosis. So this LDL, what it will do, it will deliver the cholesterol to the various tissues and organs throughout our body. Like you have adrenal glands, you have your gonads, you have your muscles, you have adipose tissue. All of them need the cholesterol for vitamin absorption, fat soluble vitamin absorption, making of this steroid hormones, for reproductive functions, for maintaining the cell membrane. All we need cholesterol. And how the cells will get cholesterol? That cells will get cholesterol through this van. The LDL will carry this cholesterol and give it to them. So this LDL interacts with the specific receptors on the cell membrane, and by which the cholesterol will be taken inside the cell, and they can be used for various purposes. So whenever there is increased amount of this LDL, and when this LDL is not cleared from the body, this excess amount of LDL, suppose if it gets oxidized etc., the structure will be modified. So this modified LDL, what it will do, it will build up in the arteries, it will start the atherosclerotic process, it will narrow the blood flow, and then it can decrease the blood flow and cause heart disease, peripheral vascular disease, stroke, etc. That is why it is called as a bad cholesterol. So here you can see the modified LDL. This has been oxidized here, and this LDL, when it is extra, it is taken up by the foam cells. There is a inflammation, there are white cells etc. which have come here, and the atherosclerosis has started. Then later there will be fibrosis, plaque formation etc. and narrowing of the blood vessels. Important is that LDL transports cholesterol from liver to the peripheral tissue. It also regulates the cholesterol synthesis, and LDL are important source of cholesterol to the extrahepatic tissues, and it is a major transport form of cholesterol in the blood. And liver also plays a very important role in controlling the LDL cholesterol. Liver is an organ which has maximum LDL receptor, so that maximum LDL is taken up by the liver and then utilized by the liver. So you can see here in the liver, the VLDL is converted to LDL. LDL will carry the cholesterol and it will deliver to the cell. HDL will remove the excess cholesterol, and this liver will convert the HDL into bile salts. So there are different types of LDL cholesterol also. LDL can be classified into four basic types. One is the large type, that is LDL1. Then you have the intermediate type, that is LDL2. Then you have the small LDL, LDL3, and very small LDL4. So these are the four categories: 1, 2, 3, and 4. So large, intermediate, small, and very small. So this becomes important because the studies show that the size of the LDL particle, the smaller the particle, the more atherogenic will be its capacity, and the smaller the particle, it has more potential to cause atherosclerosis, etc., which are building up in the plaque. So these are the smaller particles. So this classification is also done for the LDL. The levels of LDL are very important, and they are very helpful in assessing the cardiovascular risk. So the optimum level what we expect the LDL is that it should be less than 100. So this less than 100 is for the people who are not having any risk factor. They don't have any previous history of heart attack or stroke, angioplasty, etc. Suppose if the patients are having all the risk factors, we expect their LDL to be still less. We expect it to be less than 70 milligram per deciliter. But the optimum level for people who are not having any risk factor would be around 100 milligram per deciliter. Suppose if it is between 100 to 160 milligram per deciliter, we say that it is elevated level of LDL, and if it is more than 160 milligram per deciliter, yes, it is definitely very high level of LDL cholesterol. This low density lipoprotein, also called as a bad cholesterol, becomes a very important form of cholesterol, because the excess level of this cholesterol in our blood will make us prone to various diseases: your heart disease, your stroke, your peripheral vascular disease, etc. So hence it becomes very important for us to keep the level of LDL very low in the body. We will try to understand the metabolism of this LDL, so that we can also understand what risk modifications have to be done, and also what medicines can be given to the patient, and we can intervene so that the level of LDL can be reduced. Thank you so much for watching the video. Please like, share, and subscribe the channel. Thank you.